Hello, my name is Paul Perito. I'm a urologist specializing in the surgical treatment of erectile dysfunction. Today I would like to answer three of the most common questions related to the implant of penile prosthesis for patients with erectile dysfunction. The first question is, how does a penile implant work? The second is, does a penile implant enlarge the penis? And third, does a penile implant shorten the penis? These are the three most common things that I hear in my practice. I'd like to start by showing the implant first. This is the implant that I use, and in 10 minutes, through an incision this big above the penis, I'm able to put all of this inside of you. The cylinders go into the penis, the pump goes into the scrotum. There's a third part that you don't need to know about, but that's the reservoir that transfers fluid from the tank into the cylinders. When you want to have sex, you pump the implant, and what does the implant do? It creates an erection. It does not enlarge the penis. It gives you a penetrating penis for coitus. When you're done, you push the deflate valve above the pump, squeeze the penis, and the implant is flaccid, so you have a physiologic penis. So what the implant actually does is render you potent, giving you an erection, not enlarging the penis. Now, after the first 500 implants that I did, in general, most of my patients were extremely happy, but there was one common problem, one common complaint from my patients, and that was that their penis was shorter. And that was very frustrating for both me and my patients. So years ago, I devised a study where I wanted to find out exactly what would be the best predictive indicator for penile length when you performed a penile prosthesis. So what I did was I took a big group of patients, and on the day of surgery, I would measure their penis using what's called the penile stretch test, where you pull the penis, you measure from the pubic bone out to the tip of the penis. I would then measure an artificial erection. In other words, I would fill the penis with saline, so he had an erection. I would measure that, and then thirdly, I would measure the penis after the penile prosthesis was in place. Not surprisingly, the best predictive indicator for the length of the penis after a penile implant was the penile stretch test. Surprisingly, although not statistically significant, the artificial erection, in other words, the erection that that man had that day, was slightly smaller than the implant. So what my patients were doing was they were remembering their erections from years before. So then you have to ask, what's happening during that period of time from their last remembered erection to the day that I placed the penile prosthesis? Thankfully, some very bright urologists at very credible universities looked at groups of patients where we render them impotent in one day. This group of patients are patients who have a radical prostatectomy. So in one day, we render them impotent, and at least 50% of patients who undergo a radical prostatectomy will have erectile dysfunction after the procedure. So then we follow those patients for years and follow what happens to the size of their penis. Now, looking at a large cohort of studies, what I like to quote to my patients is that you're going to lose somewhere between 0.5 and 5 centimeters every 18 months from the day you're rendered impotent. 5 centimeters on a penis is like 30 feet on a boat. It's a lot of length to lose. So now we've identified that you're losing length because you're impotent. Impotency, one thing that you need to understand is that normal men will have 7 to 10 erections at night, lasting 10 minutes. It's the penis exercising. So once you're rendered impotent, that exercise is taken away and penile tissue atrophies. And unlike a muscle, which will return to its normal size if you exercise it again, unfortunately the penis has a fibrous sheath inside of it, 2 fibrous sheaths actually, and once that contracts, that atrophy you cannot recover. So in other words, from the day you're rendered impotent until the day you seek treatment, you continue to lose length. This can be extrapolated to other disease processes. For example, diabetes, smoking, hypertension, anything that causes erectile dysfunction, anything that causes your penis to not exercise at night leads to atrophy of the penis. So hopefully you understand what a penile implant can do, what it does, it gives you an erection. It gives you a penetrating penis for sex. It does not, a penile implant does not cause penile enlargement or result in penile enlargement. A penile implant does not result in shortening of the penis. Impotence results in shortening of the penis. If you have any other questions regarding erectile dysfunction and penile implants, you can go to Perito.com, and there's a wealth of information there for you to utilize. Thank you very much.